Contraception methods offered in Guyana ranges from hormonal to non-hormonal, permanent and temporary or reversible in the forms of pills, injections and surgical. But the first method is always abstinence and the use of condoms, which not only protects against pregnancy but sexually transmitted diseases. Coordinator for the Women's Health Unit, Dr. Umadai Rattan, explains that they are looking to break away from the burden of women being solely responsible for the use of contraception.
What is also available is the vasectomy for men. So our culture and society as we know it look at family planning as a woman's job and woman's responsibility. But really we have vasectomy available for men, but I think I could count on one hand how many men have opted for that in the past few years.
The Sexual and Reproductive Health Policy was launched by the Ministry of Health 2 years ago. This policy now governs the use of contraception in Guyana, and Dr. Rattan said that the unit is also working on the rollout of the policy throughout the country to ensure more women are aware of their sexual and reproductive health and rights.
Long ago it used to be if the man doesn't sign, you don't get your tie-off or tubal ligation as we call it. But no, that culture has changed, and not only for permanent stop, but any method that you choose, we, the healthcare workers, work with you to ensure that, as we call it, the informed decision-making process. So that means you know all the risks, all the options available, the pros and cons of each, and then you choose your method.
Before any method is administered, there is extensive counseling to cover any chances of adverse side effects. Dr. Rattan further explained that accessibility to healthcare was one of the main issues addressed in the policy.
Accessibility, as we would when we read about it in the policy, sexual and reproductive health policy, accessibility is one of the main things that we actually address there. And every woman across our country, it doesn't matter what her race is, her education level, where she lives, should have equal access. Now, of course, we have to be realistic. We know that some services are harder to access depending on your geographic location. So the Ministry of Health has catered for that, and what we do something called the mobile family planning clinics. So for the far areas that do not have or might not have persons trained to provide certain services, we actually go in, as it says mobile, we actually go in and provide these services to these women. However, that would hopefully soon be abolished, because we're hoping that at all of our 300 and more health facilities, all the services would be offered.
It was further noted that the unit also does mobile family planning clinics across the country in an effort to be able to reach every woman. Reporting for the newsroom, I am Isanella Patoir.